COVID ICU has been closed, so the numbers are ticking back up, unfortunately, and I was hoping that if we could stay there for a week or two. We had discussed even opening up some of the visitation. We had discussed even having a few more meetings in person and a couple of other things. But of course, under the sage advice of our chief medical officer, and that's the one thing I have to say I love about our leadership team, everyone is comfortable sharing their information. I always want everyone to feel comfortable telling me what they think, and so I try to make sure that I don't share my opinion first. but again, Dr. Filippo said, let's wait a couple of days. Let's give it a little time to make sure that we're actually treading in the right direction. And fortunately, we did not open things up too early because the numbers started going back up, as you can tell right here. Now, fortunately, we're nowhere near there, and the good news about that, again, is the COVID ICU is still closed. So the acuity of the patients that are COVID positive is nowhere near what we saw back in this time frame. However, we are still having some patients with challenges, and we still are having patients that die or die prematurely, unfortunately, as a result of COVID. So we're not quite out of the woods yet, but we're getting there. So that's the message from this slide. This is not just Wayne UNC. This is for all hospitals within the UNC system. And so right here it says UNC Health. So that's every hospital within our system. Triangle, Lenore, Johnston. I mean, everywhere throughout the state. What I want to point out is what happened. We were expecting to be pretty much done with this by June 1st. All of the predictions, all of the models, and if you looked at the upper control limits, the lower control limits, all those statisticians and epidemiologists and infectious disease experts had modeled out to where we could be done with this thing by June. But then, of course, we started to see variants. Unfortunately, we don't have the vaccination rate that we should have throughout the state. So many people are still refusing the vaccine, and that's all right, and I totally understand that. But I have to recommend, I've got a couple of slides, I'll talk about vaccines, and I'll talk about Johnson & Johnson as well. But again, what happened was, this was the where we were originally headed. So April 20th, you look there, it spiked back up. So April 6th, this is where we would have been, heading down towards that zero. Now, our numbers here in Wayne County, we were actually expecting to be at zero by June 1st, according to the original model. That, of course, adjusted. It's a learning model. That's the good thing about it. As more data comes in and we see vaccination rates and we see the rate of infection, that model begins to change. And so we have an average, and then, of course, we've got 95% above, 95% below in terms of the confidence intervals, and it gives us an idea of where we are. And so that's what we're starting to see, and this is statewide. So we're not the only ones that are seeing the uptick here in Goldsboro. I did want to share these slides. Of course, I was not a member of the team at this time, but we had similar setups like that in Memphis when I was the CEO of the hospital there before coming here. And so I just want to recognize our team for all the work that they've done. And as we've gotten additional information, we've evolved. I think this was the screening tent when COVID first hit. And of course, I want to thank the community on behalf of every team member and every physician that's a part of Wayne UNC for all of your support. The table on the upper left there has some of the food I think that was donated by many of you probably in this room. So I want to thank you again on behalf of the entire team at Wayne UNC and all of our physician partners and teammates for the support and the love that you provided for us. These are some of our technicians down here that are still doing the gift Toys for Tots, I think, during Christmas time. So we did have an opportunity to do some of those things, again, that we love to do to reach out to the community as well. And then, of course, our partners at Wayne Community College, we could not run our nursing program without them, so I have to make sure we always recognize them. We actually, I think, got all of their graduates this year to join our team as nurses at our hospital. So that's a good partnership that we have. So again, focusing on community engagement, that's incredibly important for us, and we're going to continue to do that going forward. So now a little bit about COVID. I'm going to pause on this slide, so if you wanted to write down that website or those telephone numbers, those are the telephone numbers that you can call to make an appointment to get vaccinated if you haven't done so already. If you have any questions, that website has a number of different pathways that you can follow to answer questions depending upon where you are in terms of the vaccination decision. I also recommend too, that's the other thing, as Kate said, I am not a physician, I'm a PhD, okay? And as my daughter told her little brownie troop, when she was about 4 or 5 years old, he's not a real doctor. So talk to your doctor, okay? And find out what's best for you and your individual situation and your family, okay? So, but again, you can get some information here that will be helpful and maybe help you with that discussion with your physician or your nurse practitioner or PA that's going to advise you on whether you get the shot or not based upon the risk for you and your individual situation. So please consider that and share that with your friends and family. So just a little bit about the disease, and then I'll talk about the vaccines. And I'm going to talk about Moderna and the Pfizer vaccine, and then I'll talk about Johnson & Johnson separately. But these are some of the facts that we've gotten to date from, of course, from the disease and also from vaccination. So we know that, if you get the disease, there's some short-term things that we've seen and some long-term things that we're seeing. Fatigue, soreness, loss of taste and smell. I have a friend back in Memphis who still has not regained her sense of taste or smell. And so her daughter, she got it from her daughter when she went off to college. She got it in college, came home, gave it to her mother and the family, and half of them have it back and half of them have not. And it's been 9 months now. So I don't know if that's ever going to come back or not. So that's one of the things that we are seeing, sometimes short-term, sometimes long-term. The most alarming thing I have to share with you, and I recommend, of course, talk to your doctor about this as well if you're concerned about getting vaccinated, is that we're seeing some significant organ damage in those who have been infected with COVID. Not the vaccination, but those who have been infected with COVID. So if you know of anyone who's had COVID and they tell you, I used to be able to run 10 miles before I had COVID, and now I'm winded after my first 2 miles. There's some science behind that. We're seeing brain damage, we're seeing liver damage, we're seeing heart and lung, a number of major organ issues associated with positive infections. So that's a real fact that we're starting to see. I'm not just saying here in Wayne County either, by the way. This is in the literature from the infectious disease specialists and what we're seeing in terms of the hard data around the country. Now, of course, if you start looking outside of the U.S. into other countries, we're also getting some data from there, but I'm talking specifically from the cases that we've seen here in the U.S. Those are some of the things that are coming out of that. And of course, blood clots and blood vessel problems. Now, if you look at the vaccines, there are some short-term discomforts with that. I think my first shot was better than my second, which was completely uncharacteristic because the second shot is when you're supposed to have some of those short-term side effects. So that's what you'll see, and some of you have gone through this and have had family members who've gone through this. But the fortunate thing I want to point out, no hospitalization or deaths among vaccinated folks so far, okay? We've not seen that with Pfizer and Moderna. Okay, I'm sticking with Pfizer and Moderna, and I'll explain why I did that in just a moment. So the other thing is it cannot alter your DNA. It is scientifically impossible for that to happen, okay? As one of my infectious disease friends told me, he said the likelihood of that happening is the likelihood of you being able to play a 33 1/3 record on a CD player. So I think most of you probably know what a 33 1/3 is. Yes. Okay. So, but yes, those are the kind of things that we have to make sure we share the hard science and stick to the facts. So now, here's the alarming thing that we're seeing with Johnson & Johnson. And of course, we've had 6 cases of young women who have had blood clots and low platelets. And that's the real issue, that you've got both of those, which seems to be very unusual. My physician friends and infectious disease experts are telling me that's the unusual part of this. And so we have had 6 cases, so we're talking about 1 in a million. You have better odds of hitting the lottery, but that's still someone's loved one, okay? That's still someone's child, and that's someone's wife, someone's, et cetera. So at the end of the day, that's why the pause is in place. And so, there's a lot of debate about whether it was an overreaction, et cetera, but that should give you some solace and understanding that the safety of these vaccines are being taken extremely seriously. Because we've had adverse events probably at a higher rate than that with other vaccines, and we've not done a pause, we've not stopped that. But out of an abundance of caution and an abundance of safety to make sure that we're doing this right, that's why the decision was made, at the higher level than, of course, Wayne UNC, to pause the vaccines. And so that study is being undertaken right now. And what will come out of that, I'm sure, as you've heard from all the experts as well, it'll come back to the market, but with a caution. And so providers will have an understanding of that risk. And that's why I said at the very beginning, too, make sure you talk to your physician about your individual situation, because that's where this becomes important. Now, the interesting thing, of course, is that the vaccines are different. So Pfizer and Moderna are mRNA vaccines, and this is not. And so this one and the AstraZeneca vaccine are different types of vaccine. They both do the same thing. They basically give your body a wanted poster of what to look for and what to attack and what to prevent from making you sick. So that's essentially what they both do, but they go about it in a different way. So the other 2 viruses like vaccines rather, like Johnson & Johnson, actually introduce an adenovirus. So it's actually a different approach than the mRNA approach that you find with the Pfizer and the Moderna vaccine. And so that's why you're starting to see differences in those two. We haven't had any issues with Pfizer and Moderna. Again, on the previous slide, as I showed you, there were no major issues, and we've not had any hospitalizations or deaths. And again, people all around the world have been vaccinated with that one. And so those two are really giving us some really, really good data going forward. And I think we'll probably see a little bit of a pause again going forward on the other one as we find more information and find out who it's best for. And what will come out of all of this too is your physician will be able to tell you which vaccine is best for you based upon your risk profile. And you can talk about that and decide which is the best way to go for you and your family. So, okay. Oh, this is a slide too from a physician from another system, not within our system, but I just thought it was interesting to point this out in terms of the side effects. Of course, the side effects from the coronavirus vaccines are much more significant than flu, clearly. But I thought it was interesting that if you look at the symptoms for shingles, which of course I've had too, and I think some of you in the room have already have had in terms of the vaccination for shingles, and I also had shingles as well, very painful. It's interesting that some of the side effects are worse for shingles. Some of them are better, some of them are worse. But just to give you a kind of an idea, but it's nowhere near, okay, the flu is nowhere near rather as bad as those others. But just to kind of give you an idea and some comparison of what you can expect if you have not gotten vaccinated. And there's so many folks that have been vaccinated, you can probably talk to them and get an idea of what you could possibly expect for you as an individual. Okay, so this slide, of course, I love the heart. And of course, I love kids too, as you can tell. So at the end of the day, please don't delay your care. I think, not just here, but around the country, we're seeing a lot of folks who were uncomfortable about coming in the hospital, and understandably so. I mean, you don't want to get COVID, and we've taken all the precautions to where we can make sure that you come into the hospital and are safe when you come to receive your care. But we're seeing a lot of people who are delaying their care. Unfortunately, we had to make some difficult decisions to suspend elective procedures. And elective doesn't mean like plastic surgery or things like that. Elective just means it's not emergent. So it's still necessary, okay? But we had to pause those out of an abundance of caution. And quite frankly, we needed the team members to help us on the COVID floors when we had 60 patients in the hospital and we could barely hold the doors open, hold the doors closed rather. And so we had to make those tough decisions. But unfortunately, that means that a lot of people around the country, not just in Wayne County, have not gotten the colonoscopies that they should have gotten 6, 9, 12 months ago. So please make sure you get that done. And I'll share a true story with you that a scare that we had in my family. Patricia was due for her colonoscopy, and of course, right at the beginning of COVID, so everything was suspended. We did the same thing in Memphis that probably every CEO around the country did, suspend all elective procedures. So 10 months later, she finally got it done, and they found a mass. So thank God, after 2 procedures, and the pathologist gave an all clear, said it wasn't cancer, all is well. So, but I think about that every night when we talk about whether we're going to pause elective procedures. I had that in the back of my mind. And again, we did that because we had to do it out of an abundance of caution. And I don't regret doing that because it was safer for everyone. It was safer for everyone to do that. And quite frankly, we just did not have, I know I wasn't here at the time, of course, back when the pause first started, but I know in Memphis we didn't have enough nurses. We didn't have enough technicians. We did not have enough hands and experts to be able to take care of the very sick people we had in hospital. So we had to pause those elective procedures. So please share that with your friends and family. Don't delay your care. And if there are any dentists in the room, optometrists, don't delay that care either, because they will find things as well. I had my eye exam yesterday, so they'll find things too that'll catch things early, and we can take care of it and make sure it doesn't get any worse. Last slide, I want to recognize our mother-baby unit. There are 217 hospitals recognized around the country rather, for exceptional maternity care, and North Carolina had the second longest list, only second to California, okay? But Wayne UNC was on that list, one of 217 around the country recognized for maternity care. So that's another place where we're growing, okay? So, I suspect, just like we saw when I was in the Army, after a deployment, 9 to 10 months after that, we have an epidemic of babies. So we fully expect that we'll have more babies once, once all this is lifted, and we are poised for growth and ready for that to happen. So that's one last slide I'll leave you with, and I'll stop there to see if there are any questions. But again, I want to thank all of you for your support for the team at Wayne UNC Healthcare. thank you for welcoming me and my family to the community. We are overjoyed, if I didn't say that before, about being here and being in North Carolina. I didn't want to leave when I retired from Fort Bragg, North Carolina, 12, 13 years ago, but you know, God has a way of bringing you back home and getting you where you need to be in due time, so I'm glad to be here. So with that, I'll open it up to see if there are any questions that we can answer. And I'll ask the team to jump in as well, because the experts are sitting at these two tables. And I want to recognize Kimberly too. So Kimberly has helped me since I hit the ground here, even before I got here. She's our administrative assistant, and I call her chief of staff pretty much there in the hospital, in the office. Keeps everybody straight and takes care of everything. So I want to make sure I recognize her too, because I would not, as they always say, you know, there's always 100 people standing behind everybody that's in front. So I'm just the talking head. You know, these are the great folks that are making it happen. So, but also, are there any questions that I can answer about anything? And if I don't have the answer, I'll get it to you, or ask one of the folks here at the table to help me out. No burning questions? Yeah, I don't play golf. Yes, ma'am. Yes, ma'am. Love your food, as you can tell.
Two-part question. One, like about, maybe if not the number, like what's the percentage of staff members that ended up getting COVID during that time? And how do you manage staffing with all the staff, you know, being affected and having quarantine and stuff like that?
Right. Well, I don't have the exact numbers of how many folks were infected. We have had, just as my hospital in Memphis, and I've talked to CEOs around the country, we've all had clusters every now and then. I know, like at one point we had part of our surgery team was infected. And so what we do when that happens, of course, we have an exceptional person in our employee health department, Mitzi, who actually guides us in that process. Of course, Dr. Filippo. We're actually going to have infectious disease consults through the telemedicine going forward. We'll be able to do that with an infectious disease expert too. But what we do is we make sure that we have them, just like every other place now. If someone tests positive, they have to quarantine for a period of time. But to your question about how we staffed, that was tough. I mean, that was very tough. We were using a lot of travelers, which is basically contractors, and of course that costs you more. So our rates, I've never seen rates that high in my entire career. I mean, probably 2 to 3 times what we were normally paying for teammates to help us to get things done. And I found that interesting and I'm still flying back and forth now, because of course I go home sometimes on the weekend or go back to see Pat and the kids on the weekend. And I see nurses all over the airport running to gates. So they're still doing that and making a lot of money in the process. But you know, the money is the least of our concerns. We need the experts on the ground. But unfortunately, we have had a few situations where folks have tested positive, and I don't think we've tied. I think we only had one case that we tied back to the hospital. But we continue to remind our team that, you know, when you're having your breaks, and it's easy to get tired of wearing all of that stuff that they wear. I liken it to interviews who are in the military, something called Mach 4, the old suits with the big goggle-like glasses on. It's like a charcoal suit that you wear. That's kind of like what they're wearing every day for 12 hours while they're doing IVs and all kinds of other stuff. And so that's been very difficult, but I think we've done a great job, quite frankly, better than we did in Memphis in terms of not having spread within the hospital and not having a lot of teammates out at one time. So. Okay, any other questions? Any suggestions? I take those too, yes. Okay, yes, sir.
Talk about your recruitment of doctors to our community. I know that the practice that I go to, they have lost 2 over the past years. What are you being able to do about that? What are the challenges?
Yes, sir, absolutely. And the question was, you know, what are we doing about recruitment, and what are the challenges that we're facing? We do have a bit of a challenge with recruitment. We have an exceptional team with UNC, and Kyle and Ricky, of course, they do most of our physician recruitment, and I try to talk to every potential applicant or any coming to Goldsboro. I want to go meet them. I want to go, you know, talk to them. What does their family need? What are they looking for? You know, and things like that. But what we're seeing is, unless you have a tie to North Carolina, we've got to get you here to show you what like I always say, what's not to like? What's not to like? But we have to get them here. So what we're doing now is, and I've talked to Kyle, our physician recruiter, just yesterday about this. Even if we don't have an applicant, let's maybe invite them to North Carolina just to show them. I mean, you can get to the beach in no time. You can get to Raleigh in no time if you want to go shopping. You can get to the mountains in no time. I mean, what's not to like? So, and great cost of living. So, I mean, you cannot beat the cost of living. So, but what we're finding again is a lot of the younger physicians, they like the big city. They're still young, and they want to be able to do those types of things. And so a lot of them will live halfway between here and Raleigh, which is fine. That works as well. And so we're trying to target those that either have a tie to North Carolina, have some roots in North Carolina, or have some interest in the activities that we have to offer. And then we focus our recruitment on sharing those bits of information with them. Because a lot of it is just a lack of knowledge. They don't know. And again, as someone said to me, you were destined to come back, and that is true. I was coming back to North Carolina one way or another. So, but yeah, that's what we're really looking for, and we're trying to target our approach and our strategies to make sure we leverage that. But not forgetting that we may be able to convince someone. I mean, once they come and take a look, it may be something that they're interested in. And so, in terms of the specialties, we're recruiting pretty much all of the specialties in terms of primary care, and of course not those high-end procedures, not doing open hearts, cracking chests, things like that, but we are looking for a number of different specialists in terms of, but primary care is where we really have to shore up. We do have an opportunity for some primary care. So, yes, sir. Yes, sir. Yes, sir.
As most everyone knows, the county provides EMS service
Right.
for Wayne County. Please let us know if there's anything that we can improve our operation on, or if there's anything that you can, help us improve on, or if there's something else that we can help the hospital, please let us know.
Yes, sir. Will do. And Dr. Kashiru, our medical director, hasn't expressed any concerns, but to your point, we have to make sure that is a seamless connection, and that we, basically support each other in terms of caring for the community. So, but I've not heard any concerns, but I will ask that question when I go back to see if there's some opportunities for us to grow and maybe even expand our partnership. So, yes, sir. Absolutely. Thank you for offering that up. Yes, ma'am.
First of all, I want to say thank you to 3HC Home Health and Hospice,
Oh.
and welcome to our community.
Yes, ma'am. Thank you.
To go along with the community paramedic programs and the county paramedic programs, we have a very strong partnership with Wayne UNC. I want to thank Kel Brady
Oh,
for
yes.
their help and assistance, as well as Dr. John Adams for their engagement
Yes.
and support. We have a very strong telehealth virtual care program that we're super excited about. And as we're strengthening our partnership with you and your team, what expectations would you like for us to see or for us to do more community engagement?
Oh, absolutely. So one thing I've talked to the team about, and we were been talking over the past couple of weeks. Howard, our chief of operations, is working on our goals, our organizational goals, and I've also asked him to take the lead on our strategic plan going forward. What I've asked everyone to consider in all of our partnerships and all of our even physician engagements and even our physician contracts, and so this will fall in the category of the partnerships, to make sure all of those goals and objectives are aligned. Because I think if we're all rowing in the same direction, then we'll be able to get to the end point faster and make sure we, as the old saying goes, cover all of those potential holes in the Swiss cheese to make sure that there's no opportunity for us to lose or miss the boat in terms of caring for our community. So I would suggest that, again, looking at our organizational goals, looking at our strategic plan, and there's some give and take. It doesn't have to be our way or the highway. We want that feedback, we want that input. For example, from our paramedics in the field, we need their input to determine how we're going to do things in emergency medicine going forward and make sure that it's reasonable. We can't say that every rig is going to be able to read EKGs if they don't have that equipment on the rig. So that's a partnership as well. But that's the one thing I would say is in terms of working with us in terms of our organizational goals and our strategic objectives and strategic plans for the long term to make sure that they're aligned.
Thank you, sir.
Yes, ma'am. Absolutely. Okay. Any questions about my little ones? Yeah. My daughter's just incredibly shy, so COVID has not helped at all. Ethan talks too much. So, but they're great kids. I tell you, I thank God for both of them. I can't believe we waited so long to have them. As Pat will often joke, her 20th wedding anniversary was a baby. So, a present rather, 20th anniversary present was a baby, yes. But yes, so he was born actually in retirement. I'd already retired from the Army when he was born, so. Oh, yes, ma'am. I'm sorry.
Do you have any idea about when family members may visit or at least be with the people who are having surgery?
Oh, yes, ma'am. The question was, when will family members be able to visit, especially those that are having surgery in the hospital? We've held off on opening that up based upon the numbers that we're seeing. I foresee in the very near future we'll be able to do more of that. Because again, our patients, we do have a little bit of a spike, and it's gone up to double digits, but again, it's nowhere near the 60 that we have. I mean, we're at 1/6 of where we were back in January 10th, and they're not as sick. But the concern that we have is, and the reason why you'll see me wearing my mask, I got vaccinated back in January. As soon as they said I was eligible, I was in line to get both shots. And so I got, first and second back in January. So I'm not concerned about getting sick myself. But I am concerned, and as we're starting to see in the literature, that there's an opportunity for me to spread it to you. So if you're not vaccinated, and for example, I'm real concerned about my 10-year-old. My 16-year-old, she's gotten her first and second shot. My wife and I've gotten our first and second. So we're not so much concerned, but we're wearing our masks and watching out for him now at this point. And so that's one of the things that we're trying to balance, because we do realize too that. But now, if it's a family member that needs support, or that you're the primary caregiver for that family member, then we make exceptions for that. But in terms of, like for example, when my wife went to have her 2 procedures, I had to sit in the parking lot. I went in, I walked her in, and I sat in the parking lot. They called me on my cell phone, and then I picked her up in the circular drive where the nurse was there to put her in the car. It's out of an abundance of caution, but we are not taking it lightly. Yes, ma'am. Okay. Any other questions? No. Oh. Well, thank you again. I appreciate the opportunity to talk to each and every one of you. I mean, you know how to find me. I think I'm the only Jesse Tucker in the in the Outlook over at the hospital. So anyone at the hospital can reach out to me if you know anybody that works there. Please don't hesitate to share information with us. Again, thank you for the opportunity to serve you. Thank you for the opportunity to be here today, and I look forward to seeing all of you in the future when we don't have to wear these masks anymore.
I told y'all were in for a treat, didn't I? Thank you so much, Dr. Tucker. I'll tell you why I was sitting over there and was looking across the room. We think today's focus of this luncheon, which we've, famously coined as hot topics over the years, it's not just what happens in the walls of an organization, it's outside of it, right? It's the connections with the 3HC, the County of Wayne, the Health Department, what PDM does. I mean, it's everything is what makes all this work, right? So in good times and bads, as my mama would say, you need to get on your knees and thank the good Lord when you go to bed tonight. So I do echo those sentiments. I do want to take a quick minute to tell you about a couple of things coming up with the Chamber. You should get our weekly e-newsletter, and we hope you'll have some dates on your calendar. But this is really kind of a call to action, and I'm going to, Janet Brock, if you will raise your hand. Janet has really been the lead on an annual career fair for 12 years. I'm looking at Christina Williams from the Maxwell Center, and last year we had, 3,000? Easily, over 3,000 students from across the County of Wayne and over 88 businesses joined us for this career fair. So normally when you hear career fair, you think we're hiring people. Yeah, guys, we need y'all to think forward thinking. This is about planting a seed in these young minds. Dr. Ed Wilson was the former chair of the Wayne Education Network. I see his head shaking. This started because there's an integral part, 7th to 8th grade, when a student may lose focus, right? And they may be struggling in school. They may not, they may think to be successful, you've got to go and be a doctor or a lawyer, and they're not open or have seen or been exposed to other opportunities. That's what this is about. We can't do it in person this year. We're going to be back at the Maxwell Center next year. But we're doing it virtually. There was a really cool video that Dr. Tucker alluded to that some of the doctors worked on. The Wayne Memorial Hospital Foundation, Jacqueline's in the back of the room. Make sure you like these Facebook pages, because when you see these videos, you will, it's just awesome to see the connectivity. So these individuals, we're asking people to share from 9 to 1 next Tuesday, April 27th. My birthday is next week, so this is what I'm gonna ask. This is what I'm gonna do. I just figured it out. I'm gonna ask for my birthday that people sign up to do this. And if you're like, I can't do it 9 to 1, yeah, you can, because you all used to come to the Maxwell Center and be with us pretty much all day. But if you can't do it, can you find 2 other people in your office to share that space with? You can sit at your desk. Those of you tuning in virtually, you can do it from your home. But you build this, it's really cool, the background, it's a booth that you do virtually. So you set up your website, what career opportunities are available. I'll pick on PDM for a minute, professional data management. Think about all the careers that people would have no idea of the work that y'all are leading in your business, and all these entities that y'all are helping people navigate through really difficult things and insurance and all that. So we want any and all fields coming forward. We've got about 70-ish, 80, but we need 100. So I just need 20 more people to raise their hand. But we will push out to the group that was registered today an email today, and it's got more information. If you've got any questions, you've got Laura here, Linda, Janet, me. We are happy to help you, but think about it forward thinking too. We've got not just 8th graders, but it's 9th through 12th grade students that are enrolled in career technical education courses. So, I mean, who knows? Tim, there could be a senior in high school that wants to work with Parks and Rec, right? And we might be able to pull them in on like some summer program, internships, apprenticeships, all these cool things that can come from it. So it's about planting those seeds, and it is the future, and our workforce needs us. We've got to be building up the future. So we are grateful for that. That's coming up next week. And then on the heels of that, it's Small Business Week. I always laugh when I talk about this. I'm on these like chamber blogs, and people are like, what are y'all doing to celebrate Small Business Week? And I just kind of giggle because I'm like, the week? We do it 365 days a year. Come on now. But to jump on board with everybody else, we're going to do some seminars that week. So there's one on customer service seminar, team building through healthy conflict, increasing your online presence. All those are free. Get in touch with us. We'll line you up. We've got some great speakers coming from Wayne Community College and the University of Mount Olive to help with that. And then on the heels of that, we are going to be at the Maxwell Center for the annual Friends of Seymour Johnson Gala, and are so thrilled for that event coming up. And then at the end of the month, we're going to welcome Dr. Walker and a few others from Wayne Community College for the Education Luncheon. So that's just through May, y'all. We've got a lot lined up, and we are so grateful. To echo what you were saying for your feedback, we can operate only when you tell us what you need and what's going to benefit and bless this community. So we appreciate your time today, and we appreciate your support. And again, thank you for your leadership and for the great information you shared. And with that, we are dismissed. Thank you.